Claims today that a dietary plan that cuts out sugar, bread, pasta and rice could save the NHS hundreds of millions of pounds and solve the country's obesity crisis. Well, joined in the studio by cardiologist and Action on Sugar campaigner, Dr. Asim Malhotra. Thanks for seeing us, Doctor.
Not a consultation, you know.
Well, this rash.
You can make it that way.
This is something that we've been looking at for years, how we can combat the diabetes epidemic. And what you're saying is that you think you might have an answer.
Absolutely, Jonathan. I think the first thing to say, type 2 diabetes in itself as a condition probably has the single biggest impact on NHS in terms of cost and also lost productivity to the economy. So at the moment, combined costs to the NHS of type 2 diabetes and loss of productivity to the economy is around £20 billion. And if we don't act, that's predicted to reach 40 billion by 2035. Now, what's happened with this new data that's come out is essentially what we've concluded in the last few years, that the management of type 2 diabetes has been upside down. We've been, advising people to follow a low-fat, unfortunately, what's turned into a high-sugar diet, and then manage it with medications. But actually, the reality is, when you look at the science, is type 2 diabetes is a condition of carbohydrate intolerance. So an independent organisation called diabetes.co.uk, they have an online website, and they have been advising for the last year or so a number of people with type 2 diabetes through simple dietary changes, which it doesn't involve cutting calories or counting calories, how many you're burning in the gym, that kind of thing. Simple dietary advice to cut out sugar and refined carbohydrates, so foods such as bread, pasta, as you said, white rice.
That's not that easy, is it? But bread, pasta, potatoes, I mean, these are staples. Yeah.
It's interesting you say that. I mean, for some people, they may think it's not that easy, but a lot of these people have followed this advice, and what they've done is collected data, Jonathan, and they've found that in just over 7,000 people, it saved in medication costs in 1 year about £6.9 million. Now, if you extrapolate that across the NHS with all the people with type 2 diabetes, we're talking about potentially hundreds of millions being saved. Now, you talk about not being that easy. It's interesting. I see many patients who come to me who have read some of my work over the last, several months or few years. In fact, one chap I saw only a few days ago, middle-aged man, it was pretty extraordinary. And, he came and he was quite emotional. And he said, I've been on insulin for 5 years. And within a few months, just by following dietary changes, by taking those foods out and eating other things that are still nutritious and enjoyable, he's come off insulin, he's come off other type 2 diabetes medications, and he was on 4 blood pressure pills. And he's come off 3 of those. Now, what's interesting is, at the heart of all of this, what we call the precursor to type 2 diabetes is something called insulin resistance. And the up-to-date independent science is now telling us that is actually the root cause of type 2 diabetes. It causes probably associated with about 50% of people with high blood pressure. And I know as a cardiologist, it's the #1 risk factor for heart attacks. But the solutions are actually relatively simple. Avoid processed carbohydrates, processed foods. And the other thing, which, I've written a book, which is actually just out today, called the Pioppi diet, which brings together all of the up-to-date medical science and then combines it with the secrets of the world's healthiest village, where people live to 90 or 100 and are quite healthy into old age. And what we find is that actually all of these lifestyle changes together, when you combine them, actually will tackle many of these chronic diseases. And in fact, what we need to do is prescribe that in the NHS. And if we do, very quickly, I have no doubt about this, we will solve the healthcare crisis. But the one other thing I want to say, and I think politicians also need to know this, is that we talk about this economic crisis at the moment. Morgan Stanley Investment Bank in 2015, they did a big report in the United States, and they said essentially that unless we solve the diabesity epidemic of the US, type 2 diabetes and obesity, and we have similar figures here, by 2035, it will result in 0% economic growth in the United States. So an unhealthy population is also an economically unpredictable.
So basically, you can eat yourself to better health. Dr. Asim Malhotra, thank you very much for coming in to share your expertise with us. Thank you.
Cheers.